Coming of Age is coming up next. I'm your host, Josh Newby. First today, we'll look at a growing subspecialty of care called sports cardiology. Then we'll learn about a groundbreaking new program that seeks to connect younger, able-bodied people with older neighbors who need home repair. Finally, a conversation about grandparents who raise their grandchildren and how they can best adjust their lives accordingly. Stay with us. Coming of Age starts right now. As we age, staying active in life and involved in the community can become a challenge. But with Council on Aging of West Florida's range of home-based services, you remain healthy, independent, and engaged. From Meals on Wheels and respite care to senior dining sites and the retreat, you'll feel empowered to regain your freedom while retaining what makes you, you. We've been in the community for nearly 50 years, advocating for elders and supporting those who care for our parents and grandparents. We were there when your father's health began declining, when your mother needed companionship during the day. And guess what? We'll be there down the road when you need those services too. Now, join with us as we talk together about the aging issues that matter to you. Sports cardiology brings together cardiology care for the heart and sports medicine. Here today to talk to us about this growing subspecialty of cardiology care is Dr. Tony Lee, a cardiologist at the Baptist Heart and Vascular Institute. Dr. Lee, thank you so much for joining us today. To get started, tell us a little about yourself and what first interested you in cardiology.
Sure. So I got interested in cardiology as a second-year medical student. Understanding the disease process of the heart just really made a lot of intuitive sense to me. And I liked how the treatments of heart disease are based a lot on physiological or biochemical mechanisms and also on evidence from large clinical trials. So I've been in Northwest Florida practicing cardiology for about the last 8 years or so after finishing cardiology fellowship at the University of Gainesville in Florida. University of Florida in Gainesville. And aside from practicing cardiology, I also enjoy spending time with my family, spending time on the beach, as well as different forms of exercising like running and swimming. And I also recently started trying to learn the violin. I've enjoyed a lot of different sports throughout my life, and I have a strong interest in helping my patients be as heart healthy as possible through exercise and healthy living, as well as in sports cardiology.
Okay, so we've heard the terms cardiology, and we all know what sports is, but what is sports cardiology specifically?
Yeah, so sports cardiology is an area within cardiology where we focus on the cardiac care of those who are involved in sports of all kinds. And whether that's an organized activity or for competition or those who simply enjoy sports or physical activity. So there are a number of different aspects of sports cardiology, including pre-participation examinations for younger as well as older athletes, caring for patients with cardiac disease and getting them back into sports after a cardiac event, assessing risks of family members of an athlete with a genetic cardiac condition, as well as with helping to establish resuscitation protocols for cardiac arrest during sporting events. And here at Baptist, we're really fortunate to have the collaborative expertise and knowledge of our orthopedic and sports medicine colleagues at Andrews Institute, which is a world-class organization here in terms of sports and caring for athletes.
Tell us about the screening process to detect issues or problems with your heart. What does that look like?
Yeah, so the screening process has a lot to do with the individual. It has a lot to do with the age of the athlete, their medical conditions, family history, whether the person being screened has abnormal symptoms or physical exam findings. And so one example of screening is the pre-participation examinations that you do for our younger athletes, the high school athletes in the area every June with Baptist and Andrews Institute. And this includes different aspects such as a musculoskeletal exam, vision exam, as well as a 12-point American Heart Association history and physical exam to screen for cardiac conditions. And then depending on what those things show, will sort of dictate what we do next, and whether they require things such as EKG, echocardiogram, cardiac CT, cardiac MRI, or other invasive testing. And we're hoping to actually implement EKG screening in this population, hopefully next go around, to improve the detection of cardiac conditions. In our older athletes, so what we call master athletes, for those over 35 years of age, we do some of the similar things like that. We focus a little bit more on coronary disease because that's actually the leading cause of death in these older athletes. And a lot of it depends on, again, their medical history, family history, things like that. And I think that the point of screening in general is to try to identify any conditions that may put an athlete at higher risk for cardiac event. Of course, you can't prevent everything, but we also try to better characterize the exercise capacity or training zones with the maximally tolerated exercise test to personalize their exercise program as well. So those are kind of the goals of screening and sort of how we approach that.
If there is some sort of issue or challenge that is uncovered during the screening process, I know this is a big question, but what do the treatment options look like? What do you all offer at Baptist?
Right. So I think the first step is, as you sort of mentioned, is to make the diagnosis, and a lot of the downstream sort of evaluation and treatment depends on what the condition is. So some of the testing might include exercise stress testing, imaging, genetic evaluations, possibly some invasive tests such as cardiac catheterization or electrophysiology studies in limited cases. And then after you made the diagnosis, the next step is to risk stratify in terms of figuring out which activities are likely to be safe for the athlete. And it's my belief, and I think the belief of most sports cardiologists, that for most conditions, you want to try to have people be as active as possible, because that's been shown to be beneficial for them in the long term. There are a few cardiac conditions, such as Erythrogenic Cardiomyopathy condition, in which there's exercise, particularly strenuous exercise, can actually worsen the condition, as well as a condition called chylomicrogenic polymorphic ventricular tachycardia, CPVT, easier said, which can also be precipitated by exercise. So there are certain conditions which we don't recommend vigorous exercise. There's some conditions like hypertrophic cardiomyopathy, which is a little bit more controversial in terms of very strenuous exercise. But in general, we try to get people back to exercise as safely as possible and as quickly as possible. I think a lot of it depends on what we find in terms of the treatment. So.
And finally, just a general question for you. How do people maintain their heart health, especially as they get older and they may be less physically active?
Yeah, so that's a great question. So I think, in my opinion, sports cardiology doesn't just include competitive athletes like we see in Olympics, but also older athletes just being physically active. And so I think certainly somebody who wants to compete, that's great, but just being active is very important. So I have a couple tips. So I think the first thing is to get evaluated to make sure you're not putting yourself at excess risk. So seeing a sports cardiologist or your physician is a good place to start. After doing that, the next step is to start exercising. The second tip I would recommend is to do something you enjoy. So if you don't enjoy something, you're not likely to continue doing it. The third is to be consistent. So try to think this is a long-term sort of goal, and don't think of it as just doing something for a short period of time, and don't compare yourself to when you're younger. Make sure you're doing stuff that's appropriate for what you can do now. And the current guidelines actually recommend about 30 to 60 minutes of moderate intensity exercise. That equates to about 150 to 300 minutes of moderate intensity, or 75 to 150 of more vigorous, intense exercise, aerobic exercise per week, in addition to two sort of weight training type sessions. Not really weight training, but just to sort of strengthen the muscles and such. And so I think that's one of the key components I'd recommend for people. And then the other is that, and I think this is also very important, that exercise alone is not a magic bullet that can prevent you from getting cardiovascular disease. So diet is also very important. So in terms of diet, I recommend that people stick to a healthy diet, such as the Mediterranean diet or DASH diet, as able, but also allow themselves the opportunity to cheat a little bit every once in a while, because I find that if you have something you really enjoy, but you never eat it, then you're just going to binge on that. So those would be some of the things I'd recommend. So,
Dr. Lee, I appreciate your input and your expertise. Thank you for joining us. Next, we're talking about an exciting new initiative, inspiring people to help their neighbors. Stay with us.
Transform your bathtub into a walk-in shower with TubCut.
It's the greatest relief in the world, being able to feel safe in the bathroom again.
TubCut installs in 1 day, is 100% reversible, and has a lifetime factory warranty.
I had shopped around because money is an issue, and I found that the TubCut was the most affordable choice.
Get affordable, safe, and easy step-through access to your shower.
Call TubCut at 850-529-7601.
The Reesburg Institute, Pensacola's ear, nose, throat, and voice center. We welcome you to visit us at our convenient Davis Highway location in Pensacola. At the Reesburg Institute, we offer the most advanced treatment available in a calm, stress-free environment. Since 2014, we've performed over 1,000 cases in office of balloon sinus surgery, as well as septoplasty and nasal procedures using oral sedation. The in-office procedures result in a faster healing time. Visit us and feel the difference. The Beacon at Gulf Breeze offers the finest senior living community in the area. We are here for your loved ones who need assisted living and advanced memory care services. Seniors will feel right at home with studio, one-bedroom apartments, a large dining area, a beautiful landscape courtyard, and even a salon. With professional staff and one-on-one care, your loved ones are our top priority. Welcome to the Beacon at Gulf Breeze. Welcome home.
As Pensacola's West Side neighborhoods continue to evolve, it is important to not leave our older, more established, and often minority friends behind. That's why the West Side Neighborhood Association and Pensacola Habitat for Humanity are teaming up for a cool new program where neighbors help neighbors with small home projects. Here to tell us more is Crystal Scott with Pensacola Habitat for Humanity. Crystal, thank you so much for coming on today.
Thank you for having me. I really appreciate it. I'm very excited about the opportunity to talk about what we've got going on, and we are very busy.
Absolutely, that's what I've heard. I know that Habitat does so much that folks may not be familiar with, and we're going to drill down in a minute into that Neighbors Helping Neighbors program. But first, let's start broad. Tell us about the community development program. It has nothing to do with building new homes.
It really doesn't, and you're right, Josh. A lot of people are very unfamiliar with the other services that Pensacola Habitat's able to provide to our community. Community development program is a relatively new program. We started it in 2016, and it's basically a program the ultimate goal is to sustain the homeownership within the family, within the individual.
Sure.
And so we're wanting to do critical home repairs to be sure that the families remain in their home.
Right.
We will come out and build a wheelchair ramp to allow for folks to age in place. We want to do whatever we can, again, to preserve that home ownership that exists. And it just goes right along with our mission of building homes, communities, and hope, because a lot of these stories are about community and the hope aspect of what we do.
Definitely, and I know that Habitat for Humanity and Council on Aging have partnered together on multiple projects, especially for those wheelchair ramps.
Yes,
that
absolutely,
you were discussing.
Absolutely.
Tell us about the Neighbors Helping Neighbors program. This is so cool to me, and it seems like something that we have just needed someone to facilitate. And now that we have someone to facilitate, tell us more about it.
Yeah, it's really exciting to me. Westside Garden District has experienced tons of new development. And so Pensacola Habitat and NeighborWorks, which I'll talk a little bit about if we have time.
Sure.
But we identified that the importance of being able for new neighbors to build relationships with old neighbors, and for the history to remain in the community is so important. And so we thought that this was a really good opportunity to do that in Westside Garden. And so we're excited to bring this program to the community. And again, we hope to replicate it in other neighborhoods and in other communities as well.
Definitely. Now, for those who aren't familiar, this is from A to Pace and from Cervantes to Garden.
Correct.
Okay.
Correct.
So, like I said in the intro, it is essentially what it sounds like, younger, able-bodied volunteers helping their older neighbors. How do those younger able-bodied volunteers sign up?
Well, we want you to reach out to us. Pensacola Habitat for Humanity has a huge volunteer base, but one of the things that we would really like for the folks in this particular area to do is just reach out to us. You can do that by phone, or our website has a ton of information about the program. But we want you to reach out to us. We'll provide a brief little training. No experience is necessary. Again, it's just really important for, like you said, the younger able-bodied to come on out and assist neighbors in that area.
Okay. Now, I live in that area. I walk my dogs in that area. I know that there are a lot of older, minority individuals that have lived there for decades. And their homes are in sometimes various states of disrepair. If I need help, if I'm a senior that needs help in that area, what do I do?
Well, we're hoping to reach out to those folks and kind of identify and come to you and say, hey, would you like for us to come and do a yard cleanup, or would you like for us to fix your fence, or whatever the identified issues are. But if people are watching this, we would really love for you again to give us a call. We'll be happy to come out and assess the situation and tell you whether or not you're a good fit for this program. It's a really, really exciting time. I think it's going to be really cool.
Yeah, I agree. So let's say I want to volunteer, but I am not handy. That is a true story. I am not handy at all. Not a hypothetical. What type of work am I going to be expected to do? Is there going to be someone on site telling me what to do?
We are going to provide you with everything that you need. Okay. So I do expect for you to attend and assist.
Okay.
So
Fair enough.
You're in. But yeah, we'll provide the tools, we'll provide the training, we'll provide the staff members. Someone will be there to assist every step of the way. If you're not comfortable with a more harder, skilled volunteer tasks, we will have someone there to assist with those things. Okay. So no fear.
Okay, no fear, and no excuses either, apparently.
Exactly.
Finally, why do this? You know what I mean? Talk about the community enhancement, the general betterment that you're hoping comes as a result.
Yeah, I think that ultimately, the repairs will get done. Sure. Property will be improved. But to me, the ultimate goal is really that community feeling. People are building relationships in these neighborhoods. People are telling stories of the way that this neighborhood used to look. Sure. And this used to be here and that used to be there, and talking about the history of the neighborhood. And to me, that's the bigger impact. That's really what we're trying to do, is to build those relationships, to form those bonds, and again, to build hope in the community.
That was great. That was a great pitch.
Hey, thanks.
Yeah, you were pressuring me to join, but now I actually want to join.
Exactly.
That was very good, Crystal.
That's what I do.
That's right. A great program. Like I said, I live in the area. I'm looking forward to getting involved. I hope that our senior friends are able to remain there, age in place, in an affordable fashion, in a home that's worth living in.
Yeah,
right? That's
absolutely.
what it's all about.
It is.
Crystal, thank you so much for coming on.
Thank you for having me. I appreciate it.
Coming up, the new but widespread phenomenon of grandparents who are raising their grandchildren. Stay with us.
Since 1989, TLC Caregivers has been providing the special help people need to stay independent in their own homes. TLC is an employer of choice in the home care market. Our employees are screened with level 2 background screens, drug-free, and have caregiving experience. If you have time, enjoy people, and are interested in joining us, go to tlccaregivers.com to learn more about becoming a TLC caregiver, or visit us in Cordova Square.
For more than 25 years, the potential for health improvement is seen with each patient that walks through our doors. Healthcare decisions don't have to be confusing. Make Island Doctors your medical practice.
My husband and I have been coming to Island Doctors for approximately 10 years, and we have been very happy with them, and we trust them.
Call us today and schedule a tour of one of our locations near you and take a look at our Best Wellness program. And welcome home.
When cancer tries to take you away from the things that matter most, Baptist Cancer Institute offers caring physicians and the most innovative treatment options. With convenient locations and a wide array of support programs and services, we're here to help you during the most difficult of times. As a member of the Mayo Clinic Care Network, we're bringing even more innovative cancer care to our community right here at home. When you need cancer care, we'll be there.
For whatever reason, children's parents are often out of the picture, leaving grandparents to raise their grandchildren. These empty nesters suddenly have to remember how to raise a kid and how to budget and adjust their lives accordingly. It's fortunate the grandparents are there to do this, obviously, but it's not easy. Let's hear more from Wendy Meredith, who participates in the local support group. Wendy, thank you so much for coming on today.
Thanks, Josh. Thanks for having me.
Absolutely. Tell us about why this happens. Why do grandparents often have to step in and raise their grandchildren?
Well, there's a numerous, amount of reasons, but probably the most common reasons are parents die, and grandparents are still living.
Sure.
Some are incarcerated. Behaviors, things of that nature.
I know the opioid epidemic has also contributed massively to this.
Yes. That's how I was introduced to
really?
the grandparents raising grandchildren. Through my day job, I actually work teaching nutrition and wellness skills, life skills to individuals of limited resource.
Okay.
And a lot of those are in drug and alcohol rehab centers.
Okay.
And I saw that a lot of these kids that were taken away from my actual students were with grandparents.
And like I said, I mean, it's terrible in one way, but it's good that the grandparents are there sort of as a safety net to provide for the grandchildren.
I call my group of grandparents raising grandchildren my superheroes.
Oh, absolutely.
They're my superheroes.
I mean, I am raising a child right now with my wife, and then, having to have the child leave the home and then have to do it all over again when you're in your 60s or 70s. I mean, they are superheroes, yes. Absolutely.
I'm sorry.
Oh, no, it's okay. I'm curious, do you find that the arrangement is generally temporary, or does it tend to veer more towards permanent?
Josh, it's sad sometimes.
Yeah.
It starts temporary.
Sure.
And then as the grandparents build even a closer bond, and they're in control now of these children, and then you have their own children maybe coming out of drug or alcohol rehab or incarceration, then you really start getting into legal battles and things of that nature. So I see both.
Yeah.
And there really isn't a happy medium.
If I'm a grandparent and I can sort of read the writing on the wall and I see that I'm going to start need to raising my grandchild, what do I need to know? What advice do you have for that grandparent who hasn't had a kid in the house in 30 years?
Join the PTA.
Okay.
Get to know some of the parents of the younger kids.
Sure,
the younger generation.
Absolutely.
Get to know what is going on and what do the kids like to do and the activities in the community, because they've changed. They've changed a lot. Yeah, and join a support group for themselves. Find another group raising grandchildren.
Yeah.
Find all the resources in the county and state that offer assistance to grandparents raising grandchildren. Yeah. They're out there. It's just you have to search for them.
What are some of those resources? Because I can imagine a lot of grandparents just suffering and having some real challenges, not knowing that there's help out there.
Yeah. Well, Council on Aging definitely is one of them, and Margaret Gerald and her group with Grandparents Raising Grandchildren definitely offer a lot of resources, because they bring resources in such as my day job through the University of Florida. We teach nutrition, wellness, parenting skills, things that can help refresh those skills that you might have forgotten.
That's right.
Yeah, social media, you know, get on the social media network and find other people in their same situation. There's a lot of legal help, free legal services in our county that can help. The Habitat for Humanity has that, the housing and repairs and things that, you know, will help. We have SNAP. You know, SNAP can definitely come into play. You know, grandparents are, you know, they have went for their retirement, and now all of a sudden their retirement funds go to starting raising a family again. So now it's time to bring in resources that maybe they've never had to use before.
Absolutely. And it's important to put their pride aside, right? Because I mean, let's be honest, your retirement, you know, your Social Security, your pension was not intended to raise a whole nother generation, and it's important to supplement that.
Exactly, that was what I was going to say next.
Yeah. Oh, well, perfect.
Yes, get the pride out of the way and take care of yourself. You know, feed yourself healthy foods. Start doing some type of relaxation, some type of mindfulness. Get out there and join some type of walking club or physical fitness because, you know, you're not as young as you once were.
Right.
And it does get harder. And to keep up with these little kids,
it's a whole different ball game, literally.
And then you have teenagers, and then again, you start right into the college scene again. So, yeah, it can be challenging, but I have seen these grandparents be very successful. I have seen them actually grow younger.
Oh, wow.
If that makes sense.
Yeah, absolutely.
Okay. I have 5 children of my own, ranging from 32 to 15. My 15-year-old has kept me young. You know,
we have no choice, right?
Exactly.
You have to keep up, right?
Yeah.
I'm so glad you mentioned the need for support, and it's something that we tell our caregivers as well. If you don't take care of yourself, there is going to be no one to take care of your spouse or of your parent or of your grandchild. So I'm glad you mentioned that. Wendy, this is a vital issue, and I'm so glad you helped me shed some light on it. Thank you so much for coming on today.
Thank you.
And until next time, enjoy life. You've earned it.